Hi everyone. Speaking about, I'm Shreyas BM. We all know that, right? I'm still a 9 standard boy, but I have passed MBBS studies. Okay. Now, so introduction to you guys. How are you? Are you perfect, healthy? No, someone will be not healthy. And today our main topic is about the medical term malignancy. Okay, I know it. So, does everybody know it? The term malignancy means, guessed it, cancer. That main topic is. So, have you heard the term? Everybody, you have always heard the term malignancy. I mean, cancer. Everybody keeps speaking. What is this term? Cancer. What is this term? In English words, we will use the term malignancy. Okay. So, what is this term malignancy? We are going to refer to that. It is a abnormal cell growth. So, abnormal cell growth. Always it needs to be abnormal. No. Sometimes it may be benign or malignant. Okay. So, what is this term known as cancer? Cancer refers to abnormal growth of cells, which they grow rapidly damaged. So everybody will be thinking, what is this? Why? How does it occur? It is very, yes, it is very dangerous, right? Oh, we also get it is equally dangerous. So now, what is the term? How does it? Now, our body is composed of so many cells, right? So each cell will be divided by a process of cell division. Two types are there, meiosis and mitosis. So this cell some usually has nucleus. Not everybody as do RBCs will have nucleus and it will go. We know that. So, but every cell will have nucleus. Inside the nucleus, there will be nucleolus and chromosomes. Chromatin fibers. So, inside the chromatin fibers, we have the basic unit called DNA. So, if you are supposing, if you will ask, if DNA breaks, if DNA will be damaged, cell will fix it. Means it will, there's a two method. Either it will fix the cell DNA or it will instruct the cell to die. Or we'll say the lysosome. We'll do that. But they will ask, if none of this works, what shall we do? How it is possible? If none of this works, what happen if you ask? If none of these works, said the damaged DNA will damage everything. It damage DNA. DNA will be damaged, but cell will continue to grow. So cell will continue to grow with the damaged genetic fibers, that is deoxyribonucleic acid, and it will form a group of inorganic damaged cells. And this damaged cells only we'll call it as cancer. Cancer means to spread. To spread. The meaning we will say that wondering metastasis and cancer. So now cancer, stages of cancer, or we will call it as mass. Need not be cancer. Sometimes we call it as a tumor. Tumor is divided into two types. Benign tumor. Benign. First is benign. It will simply, some mass will grow. Simply, some because of some infection or something other reason, benign mass will be grown. If this benign mass spreads, starts growing and spread, it will not happen. But if in this case, second type, we'll call it as malignant tumor. Remember, I was talking about malignancy in first starting. That is only malignant tumor. This malignant tumor is also known as cancer. Cancerous in spread. This malignant tumor has two types, right? Mm, Primary, if someone has a cancer, brain tumor, or suppose we say, or gastric cancer, let's say the gastric, where it is originated, gastric cancer. Primary point is gastric stomach. Okay, primary site is primary tumor. If it has not spread, suppose if it has spread to brain, spread to esophagus or bone, or the bone on the femur, or brain, cerebrum, every organ. Then the secondary cancer is secondary cancer, or you know, it's metastatic cancer, advanced cancer, advanced carcinoma. Really, I mean cancer, all those things. So, advanced cancer, metastatic, metastatic cancer means it has spread. Now, primary means similarly in the stages, stage one, the cancer is still is in a small baby form. We'll say small when we will grow up, infants. That is a form of cancer in stage one. Children, when we will grow, we will be as children. Uh, but in stage two, it will still keep growing like a teenager. We will say, example, keep it like that. However, in stage three, what will happen? No, that cancer will spread to lymph nodes. You have heard of lymph nodes, right? In this case, not metastatic spread, but it will spread. It's a sort of metastatic, but it is not organal. Spread is known as metastatic. And lastly, stage 4 and 5. There's not 5, but 5 is a more. 5 is also there. Stage 4 is a metastatic cancer. It is very hard to treat metastatic cancer in old age. Young age also it is very. If treatment options if they are poor. And in stage 5, it's the most advanced cancer. Stage 4 and 5 are all same. Advanced. Treatment can't be given. Okay. So, what are the types of gastric cancer? So, cancer has four types. Okay. Cancer has four types. So, the cancer which has four types uh, is called as first type is carcinoma. Noma. In this type, carcinoma. What is this first type? Now we will discuss. Land. Carcinoma means organ. Epithelium. Somewhat like epithelium cells, glandular, or organ. It should be specific organ like liver, bone, not bone, liver, kidney, brain, stomach, esophagus, skin. Skin is the largest. No. Carcinoma is divided into four types. Some types are there, four types and some type. Adenocarcinoma, okay, which means to gland. Example, the most fierce form of adenocarcinoma is pancreatic adenocarcinoma, in which stage 4 is not treatable. Most doctors say, have you heard? He's got pancreatic adenocarcinoma. He will die in less in 4 weeks. But yes. So example, these are glands. They were spread to glands. Next. So second type, another types are squamous cell carcinoma. Example, squamous cells, gastric cancer, another type of. Okay, squamous cell carcinoma, skin cancer, basal cell carcinoma. Again some cells, right? Next. Again, they are different. Hepatocellular carcinoma, renal cellular carcinoma, right? They are. Then second type is sarcoma means connective tissue. Okay, connective tissue like osteocarcinoma, osteosarcoma. Next, what will though some cases they are known as multiple myeloma. Because they will not say because multiple myeloma is not osteos because they are rising from WBCs. Again, we'll discuss later. Uh, because so what are osteosarcoma and other connective tissues, tendons, ligaments, called sarcoma. Not because they're sarcomere and all. Next, third type is most frightening. Have you people heard of blood cancer? Oh, we'll say blood cancer. It is very scary. And the third type is blood cancer. But we will use it. But give it a little term, right? We will use it as leukemia. Leukemia. Okay, this is the either RBCs, WBCs, WBCs in other form, not lymphoma. This is RBCs. Will regularly replace. This can only be treated by stem cell transplantation, chemo. Then we'll discuss later. Okay, so leukemia, blood cancer. Next, next type is leukemia has other types. The acute lymphoblastic leukemia, myeloid leukemia. It depends on where it is situated. Next, we were talking about next type is lymphoma. Lymphoma is again WBC, specialized WBCs. Not because of it's specialized to immunity. Lymph cells, lymph nodes, lymphocytes. Cancer, if it comes, it will call it as lymphoma. Okay, so we are going to call it as lymphoma. Why? Because we are going to call it as because it's a WBC. It is also the Hodgkin lymphoma, non-Hodgkin lymphoma, other types. You guessed it. Okay, so lymphoma it is again little trickier, right? So next you may be asking, how can we diagnose cancer or malignancy? That's right. So here will be everybody knows that it is CT, MRI, but it can be for diagnosing the mass part, as I told you. Mass. Benign. It's not some mass. We will use some scans. CT scan computed tomography, MRI, magnetic resonance imaging scan, X-ray, ultrasound in case of hearts and all. But scans means ECG, not the echo. Ultrasound same we will say. And for not scanning, you can use endoscopy, colonoscopy, bronchoscopy, laryngoscopy, every forms of scope. Okay. And for the they will ask, but they have found the mass. How can we confirm that it's cancer or not? For this part, we'll use a procedure, not surgery, procedure called as a biopsy. They will take, they will insert. In case of endoscopy, they will not take any holes, but directly pull out the sample. But in case they will use a CT guided biopsy, anything. Biopsy is the four types: FNAC, core needle biopsy. Those are little complicated. So biopsy, if they will take up sample, they will put a needle and take out the sample and view it under a microscope. Remember, you should see cells. We can see cells only in microscope, but except for blood cancer, leukemia, testing lymphoma, and all, you need blood test is enough. That is also a biopsy. Okay, blood tests all are bone marrow density, all those tests. Next, suppose how can we treat this condition? Most are not treatable. Some are treatable. We'll use surgery to remove, but most will use radiotherapy to shorten the. When it is not spread, surgery they will use. When it is spread, chemotherapy, immunotherapy, radiotherapy. For mega advanced cancer, there are no cure for presently now, but they're doing. Other types are electrocautery, immunotherapy, hormone therapy, chemotherapy, radiotherapy, all are there. But some patients, even though they get treatment, they will not survive. In this case, but some are not curable. We have to use palliative care treatment only. That is it. But either way, how can we avoid? It is not unavoidable, but some of the steps to prevent it are not smoking, no inhaling smoke, means avoid smoking, no smoking, avoid air pollution, keep your environment clean, and or avoid the smoking will cause oral, brain, everything it will cause. And liver, for liver, lungs will include smoking. For liver, it's worst part. Don't drink. Stop drinking. Whoever does, so advice to stop drinking. It's a healthy. Everyone will get liver cancer from will stop getting liver cancer for hepatitis C, or it will stop. It will get. So take everyone will. It is nice. Meet you again. Thanks for watching the video. Subscribe.